The World Health Organization said that the death of 66 young children in Gambia from acute kidney injury may have been caused by contaminated cough and cold syrup, manufactured by an Indian drug manufacturer. The World Health Organization issued a medical product alert on 4 cough and cold syrups manufactured by Maiden Pharmaceuticals Limited in India on Wednesday. These can be potentially linked to acute kidney injuries and 66 deaths among children in Gambia. WHO stated that it was conducting additional investigation with the company and Indian regulatory authorities. The 4 medicines are produced by Haryana-based Maiden Pharmaceuticals Limited, which launched its operation in 1990. It reportedly has an annual production capacity of 2.2 million syrup bottles, 600 million capsules, 18 million injections, 3 lakh ointment tubes, and 1.2 billion tablets. The WHO said that the 4 substandard products are promethazine oral solution, cofexmalin baby cough syrup, Macof baby cough syrup, and Magrib N cold syrup. Substandard, also known as out of specification, are authorized medical products that fail to meet either their quality standard or specification or both. WHO Director Dr. Tedros also stated his concern regarding the cough syrup and said that the loss of these young lives is beyond heartbreaking for their families.